Hi, my name is Mike Kruskamp. I'm going to give you a brief presentation on controlled substance prescribing in skilled nursing facilities. This presentation is going to be geared for prescribers. The goals of this presentation are to understand why a prescription must be written for patients in a skilled nursing facility. I want you to know the requirements for a legal prescription. I want you to know the options to communicate a Schedule 3 through 5 prescription. I want you to know the options to communicate a Schedule 2 prescription, and I want you to understand the application of emergency Schedule 2 prescribing and prescription. To give you a little history on this, essentially there are very few law changes. There's a legal action taken out against Omnicare from the DEA. Many of the laws were clarified. An example of this is the continuance of therapy for controlled substance prescription that you'll see. It's essentially a blank form for you to fill out the prescription and then fax back to the pharmacy because the pharmacy is no longer allowed to do that. More applicable to this presentation is how hospitals are different due to their DEA registration from a skilled nursing facility. The prescribing of non-scheduled medications is essentially the same between a skilled nursing facility and a hospital, with chart orders and maintenance medications not having a length of therapy. With controlled substances, however, it's different. It's different because prescribing of controlled substances must be done via a prescription for skilled nursing facilities, not a chart order. This is because skilled nursing facilities are not registered by the DEA. For purposes of controlled substances, they are not recognized as healthcare institutions. The only actual law change that occurred was in 2010. The DEA drafted a law allowing skilled nursing facility employees to act as agents of a prescriber through a signed agreement, and they call this an agency agreement. An example of the written agreement was drafted into the Federal Register. Prescription requirements. You should be familiar with all these. This is exactly the same as the requirements for a prescription sent out to a retail pharmacy. It includes the patient's full name, address, the practitioner's full name, address, and DEA number, the drug name, strength, form, tablet, capsule, liquid, the quantity prescribed up to 6 months for Schedule 3 through 5s, and 60 days for Schedule 2s, not 90 days like in a retail setting, and this is because this is a skilled nursing facility. The 90-day allowance did not get drafted into law for these facilities. Also, you need the directions for use, obviously, the number of refills authorized for a 3 through 5. You cannot do refills for Schedule 2s. And the prescription must be manually signed and dated by the practitioner on the date that it was written, unless it was called to the pharmacy by an agent of the prescriber for a Schedule 3 through 5, and unless it was called to the pharmacist from the prescriber directly in an emergency situation for a Schedule 2 medication. A little bit about agents of the prescriber. First of all, it is not legal for a skilled nursing facility employee to communicate an order or prescription to the pharmacy for a controlled substance, unless, of course, the employee and prescriber have signed an agency agreement, which allows that person to perform a limited role in communicating the prescription to the pharmacy. Currently, agents of the prescriber are their office staff, and no agreement has to be signed between their office staff in order to do that. Currently, also, agents may fill in information on a prescription blank for the prescriber to sign. However, the prescriber has to review it and sign it before sending it over to the pharmacy. For Schedule 3 through 5 medications, there are 3 allowed methods of communication. 1. The original prescription may be delivered to the pharmacy. 2. The original prescription may be faxed to the pharmacy from the prescriber or their agent. Or 3. The prescription may be called to the pharmacy from the prescriber or their agent. Also, if a legal prescription is presented to a skilled nursing facility, they may fax it to the pharmacy, then have the pharmacy pick up the prescription upon delivery of the medication. For Schedule 2 medications, there are only 2 allowed methods of communication. 1. The original prescription may be delivered to the pharmacy, and 2. The original prescription may be faxed to the pharmacy from the prescriber or their agent. And we can do the same thing with the Schedule 2 as we can with the 3 through 5s and have the skilled nursing facility fax over a legal prescription, and then we'll have our delivery driver pick that up upon delivery of the medication. There is an exception for Schedule 2 medications in an emergency situation, but it must not be possible to provide an original prescription to the pharmacist via hard copy or fax. In this case, the prescriber may call an emergency prescription directly to a pharmacist. No agent may be allowed in this phone call. and only enough medication to cover the emergency period may be called in to the pharmacist. Also, within 7 days, the prescriber must furnish to the pharmacist with a written prescription to cover for the emergency dispensing. If no prescription is provided to the pharmacist must report the prescriber to the DEA. Failure of the pharmacist to do so will result in loss of that pharmacist's ability to take a verbal Schedule II prescription in the future. Skilled nursing facilities, just like hospitals, have emergency after-hour cabinets. This cabinet is an extension of the pharmacy. Pharmacists must review all orders for medications removed from the cabinet within 48 hours of removal, except for controlled substances. For controlled substances prior to removal from the cabinet, a pharmacist must verify that there is a legal prescription. So if a prescriber was to call into the facility to have a nurse remove Norco from the emergency backup box to directly administer to a patient, the nurse should tell the prescriber that they cannot do that, as they have to have a legal prescription verified by the pharmacist. What the physician should do is call the pharmacist, give them a prescription with quantity and refills, and then the pharmacist will call the nursing facility and authorize them to access essentially the pharmacy to take the medication out for administration to the patient. As we know that this is a big inconvenience, AIC has set up an emergency controlled substance hotline. The number is 605-550-0005, and that phone number will connect directly to a pharmacist, whoever is on call at all times. If the call is missed, an email and text message with the voicemail will be sent out to all pharmacists employed by AIC, and that's going to include our owner, our manager, and all other pharmacists that staff here at AIC. Now, you can call our normal phone number, 772-7770. That will connect you to the answering service. We still use them. And you can always fax us an order if you have access to a fax, and then call the answering service and just let them know that that order's there. Or you can even call the nursing facility and let them know that there is a prescription in the fax at the pharmacy, and then the pharmacist can review that. However you'd like to do it, essentially we just have to make sure that there is a prescription at the pharmacy. Most of our pharmacists can check our fax from home because that goes to an email, so we just want to make sure that however we've got to do it, that we get it to the patient as quickly as possible. We don't want any delays in morphine or Norco or anything like that. So, in summary, controlled substances must be prescribed via a prescription. Versus a chart order, a prescription includes quantities and refills. Schedule 3 through 5 medications may be communicated via phone, fax, or hard copy. Schedule 2 medications may be communicated via fax or hard copy. An emergency Schedule 2 prescription may be called directly from the prescriber to the pharmacist. However, you do still have to follow up with a hard copy prescription on that, whether you fax it to us or mail it to us, and it's got to be within 7 days. If you have any questions, please submit them to my email. It's mikecruzcamp@aicrx.com.